there's a lot that's on our lives nowadays, but there is always hope. We always have to keep hope alive. And it's important for parents to know that, yes, starting at infancy is great. The sooner the better, but it's never too late. I
Yeah.
love my CPAP now. I've been off for 3 years. So if it can happen for me, it can happen for anybody else as well. And so always trust that instinct, that motherly instinct that tells you something is not right or there could be more, and look for it and trust it and do the best you can until you know better.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hi, everybody. I'm Dr. Nancy O'Hara, and I'm really excited to introduce you to 2 of my favorite people, and definitely 2 of my favorite dentists, Dr. Lynda Dean-Duru and Dr. Krystle Dean-Duru. They're pioneering mother-daughter duo that really are transforming pediatric dentistry with an integrative, airway-centric approach. With over 35 years of combined experience, they specialize in optimizing the growth and development of our children, focusing on how craniofacial structure really impacts systemic health. And their expertise includes advanced therapies such as laser-assisted treatments, orofacial myofunctional therapy, growth guidance appliance therapy, and all of this supports holistic health and development. And they're really passionate about educating families. We've lectured together and also helping professionals on the connection between oral health, airway function, and overall well-being, especially in complex cases like what we see in PANS and PANDAS. So thank you both so much for being here.
Thank you. It's a pleasure. Thank you so much for having us.
No, and tell our listeners, our viewers who are parents as well as professionals, how you got here, how you got to look at this stuff in this way.
It's a very interesting question because I'm a recovering sleep apnea patient myself. And as a matter of fact, I was CPAP dependent for over 7 years. And the way that I got diagnosed was like the 5th internist, because I couldn't recover from what we thought was bronchitis. She took a look in my mouth and said, "You must have sleep apnea." And I'm going, I've been a dentist for a long time. If there's something in the mouth tells about sleep apnea, I would know it. I know, right? So she sent me for a test and she was right. I had moderate sleep apnea. My symptoms were severe. So she put me on a CPAP, and those symptoms of brain fog, all those things, they went away. And it worked great for 7 years. Then it stopped working. And my option was to have my jaws broken so it could make more room for my tongue so they will stop falling into my airway space. And I was like, no, thank you. And in options for myself, I got to find out a lot more about sleep and breathing and how well your face grows and how it impacts that. And I look at pictures of me at 9 months of age, all the signs were there. I had that clenched fist, the twisted neck, open mouth breathing, which later on turned into like anxiety and migraines all the time. Anyway, long story short, so it became clear to me that the signs are there from infancy, and we see babies as early as 2 days old. So we have the ability and the privilege of being able to redirect their growth. And that's how it was like going back to school. So that's how we started a lot more holistic, the journey of being more holistic and tackling it from infancy and growth guidance as well. So
And root cause.
And getting to root cause issues. That's right. Yeah.
Absolutely. That's why we have so much in common. It's really about, because even though, maybe getting to the sleep apnea was the root cause of your fatigue and all of that, getting over the bronchitis, but even deeper than that, the CPAP was almost a little bit of a blame it, tame it sort of
Yes,
thing,
yes,
as Dr. Baker would say,
yeah.
and really looking back at the things much earlier on and all the wonderful things you do for our kids. Yeah, it's fascinating. So, how do airway health, craniofacial development, oral hygiene, all of that influence the inflammation that our children with PANS and PANDAS go through?
Well, I mean, it's a great question about so many years of knowledge trying to put into in the, short answer. However, the body has to be able, or the mind, the brain has to be at a proper relaxed state, right? That
Yeah.
autonomic nervous system. And so if they're not breathing well, say because their jaws are small, their tongue is not fitting where it needs to fit, and the growth of what they're supposed to, the way they're supposed to be growing is not growing in the right direction, that increases that sympathetic, drive, which
Right.
doesn't allow for good sleep, doesn't allow for good breathing, doesn't allow for good immune system, immune function and healing. And so the pieces were never kind of put together sometimes with different providers and things like that. But when you start to think about it and you see it in a young child, you see it actually happening where they're just not functioning well because they have flat affect, their mouth is open all the time, they're breathing through their mouth. There's a lot of inflammation because they're not using the apparatus that's supposed to filter the nose and filter all the pathogens and warm the air and not make it so difficult for their bodies to breathe. Then their bodies are trying to then figure out what to fix, what to heal. So we started to see that connection over and over and over when you just have a small jaw, not enough room for your tongue, or your tongue is attached, right? You have tongue tied or other tethered oral tissues that starts to affect how everything functions, and so it's like a ripple effect throughout the entire body.
Yeah, yeah. And you can see just in the way you're talking about it, how the craniofacial development, the airway health affects that fight, flight, or freeze that we always talk about, that our kids with anxiety or PANS PANDAS specifically go through,
Right.
and how that impacts the vagal nerve.
That's it.
Yeah.
So even, go ahead.
Actually, I was just going to add is that it might even start from birth. And so obviously the environment where the baby grows influences how the baby comes out. And also when birth is our first traumatic experience. So coming through the birth canal has its own trauma that is associated with it. So, and even with C-section, they have to pull the head out. So as the baby is coming through the canal, all the skull bones, the cranial bones are all in little pieces, and so it's much more fascia and mucousy. And so if they're coming and there was prolonged labor or there was induced labor, like a lot of compressive forces, that might actually affect especially the us. And the two very important nerves come out from there, and that's the hypoglossal nerve, which supplies the tongue, and the vagus nerve, which is your rest and digest. So if it gets compressed even at birth, somebody has to know that and be able to say, okay, here's what we do osteopathically to get the motion that the body needs so that the brain can actually function properly. So it starts very early, you're right. And
I remember years ago, a craniosacral therapist saying to me, in our very developed country, we are one of the few countries that doesn't do osteopathic craniosacral maneuvers after birth. And it's part of why we have so many ear infections, sinus infections, and as you're saying, all of the airway health and craniofacial development.
Absolutely. And the lack of, or our feeding practices have changed as well. So breastfeeding is not, encouraged and motivated as much. And it's very important to understand that breastfeeding is not only for nutrition, is actually for the development of the face. So as we talk about that birth, right, if you already had a traumatic birth and you don't have the ability to, you have compression, but then you don't have the ability to breastfeed, there's certain things that are still continue to stay tight, and the development of your face, the tongue that's supposed to be using to help build your face doesn't get the exercise or the movement and the motion that it's supposed to, which then has downstream effects, right? We're supposed to suck, swallow, breathe as soon as we come out. That's a neurological stacking that needs to be done for other things to start manifesting or execute in our brain. So it's just
Wow.
it's
Wow.
amazing stuff that happens as we're coming out into this world that we're supposed to get, that we've kind of just let go as like, oh, it's just because everybody's not able to do, then it's common, right?
Yeah.
It's normal.
Or it's normal, right? So yeah, it's very interesting.
And you mentioned that you see babies as young as 2 days old. I mean, up where I live, people aren't talking about going to see their dentist before 2 years, let alone,
Right.
even later than that.
That took stuff.
And that's amazing, much too late.
Yeah.
So how do you get people to know to come at 2 days of age, or even as infants? Are you dependent upon referrals? I mean, how do you help families to see this?
Yeah, for the most part, yes, they come to us because they're having latching problems.
Yeah.
Besides that, for the past 7 or 8 years, we've been educating our parents, and they go, okay, you're having that baby. The next time you have a baby, you have pain nursing, you need to come see us. So it's not supposed to be painful. It's supposed to be enjoyable for both the mother and the child. And so that's how we get a lot of them. And some of them come from pediatricians and lactation consultants and doulas as well.
Yeah.
And the
Okay.
good thing about it is that in our practice, there's a bigger understanding of why a baby may not be latching, because it's not always because of tethered tissue, it's not always because of tongue tie. It's important to understand the story of that birth, and also do non-surgical things. Really, like you mentioned, that non-surgical laser treatment, that's one of the things that we do to loosen up the fascia. We work collaboratively with an osteopathic physician just to make sure those cranial bones are having good motion, and the impingement and the compressive forces are no longer as affected on there. And then if the baby still can't latch, or we see like a structural tie, we first still have to have the nervous system ready before you inflict more trauma on it. So sometimes some parents, a lot of places they go, they can breastfeed, they just cut the tie up and snip
Right.
the tie, but really isn't what the baby needs. You first got to understand that the birth process may have made it difficult for this baby to nurse, which is something that should come naturally. They get out, they crawl up, smell the boobs, they don't even see it, and they grab to it and go, latch onto it, and then swallow, breathe, and then decompress. And so whatever made it so that that baby couldn't do what it naturally is supposed to do, you find that and help them get back online.
Yeah.
So yeah.
Oh, that makes so much sense. So much sense. But talk a little bit more about all of the laser therapies, whether it be baby lays, or lays, laser assisted dental fillings. Go through them a little bit for me.
How do we start? So it's similar. Let's see, the non-surgical is somewhat similar to the photobiomodulation concept. I call it concept because typically photobiomodulation, which you're using light energy to cause, biological processes or biological effects, especially to the mitochondria and all of that. But typically PBM doesn't use heat. Well,
red light.
Well, yeah, like red light therapy, something find at your PT, OT, things like that. But what we're using penetrates even deeper. It uses heat, but it doesn't destroy the tissues. It goes to the 1064 nanometer wavelength. And that is able to then now not only go to, get down into the cells, it gets down into the nervous system. It can touch a nerve, it can touch blood vessels, it can then open up the muscle, like get deeper into the muscles and just release the fascia and fiber. Because that fascia is what's holding our nerves, is what's holding our blood vessels, is what's it kinked up and gets tightened. And so it's able to melt the hyaluronic acid crystals that have built up. So that's been a beautiful thing because then, and that, yeah, so that allows for glide and motion of the muscles. Once you melt the hyaluronic acid that's been, kind of frozen. Once you melt that, it allows more mobility in our bodies, and motion is everything. I mean, it sounds very hippy dippy, but motion in our body is everything. And our fascia, if that's tight, you don't get motion in your blood vessels, you don't get motion in your muscles, you don't get motion in your nervous system, which is extremely important, especially for these babies like we talked about. And so being able to put some light energy in the back of the head, in the tongue, in this oral facial region, knowing that the tongue is connected all the way down to the tip of the toes through body fascia, right? So if you help release that, then you can actually see a structural tie, because a tongue tie is not just fascia, it's complex tissues. So you want to actually be able to cut what you're supposed to cut. So that's, and so baby lays and oral lays, developed by Dr. Nordstrom and Dr. Andy Tenholder, that they developed it using all different types of other principles, acupuncture as well. So it's different techniques that are used along the head and the neck area. And
you can use it all over
oh yeah, you can use it all over the body, but for the oral lace, baby lace therapy, that's what it is. And we're dentists, so we're here.
Yep. I hear you.
Sure, right? For ourselves, I use it everywhere. The laser everywhere.
Yeah. Now, how does that reduce inflammation?
So with the reduction of inflammation, if there's any compression, it's also increasing the mitochondria. It's the mitochondria. You can hit light energy, and there's so many studies that talk about it, that you're improving how a cell works because of the metabolism from the mitochondria. So that's doing all different types of magic. It's also
blood flow.
Yeah, go ahead. Yeah.
Increased blood flow as well.
Yeah.
To the areas.
You're more able to resist, and your body is more able to fight infection and inflammation as well.
Yeah.
Right. And if you're if you're supporting that neural integration and also reducing that tension, that in of itself can reduce inflation.
Just making things work better, right?
Yeah.
Like just waking things up. Like that's what we forget. Sometimes you like we talked about the compression that lasts throughout life. It doesn't, and it's not that the nerve is not working. It's just not transmitting as robust and readily like it's supposed to. Right. That it's been game changing, to be honest. For someone like me who needs to see, and I'm a dentist, right? So we need to cut, very structured things, and we need to see and remove and do all these things. This has been such a big, huge change in just allowing light energy, which you can't see, you feel warmth, but you can't feel it, to do a lot of magic. And it's done a lot of magic on ourselves and our patients and things like that. So that's been amazing in that biostimulation world. But then to continue, we use lasers to cut, to help us do surgical cutting, which is what I love the surgery portion. So having like a laser that's able to do it without a lot of hemorrhaging, with just healing, is just amazing. It's very precise, but you have to understand laser physics. Some people just get the laser and just start, you can't do that. You have to understand what's the tissue interaction, things like that. But once you do, and just being able to use it for different types of, it's helping with warts, herpes, it's helping with, inflammation in the mouth. It's when we're using it for laser fillings, right? You're removing less tooth structure. It's directing, because of the wavelength, it's a different type of wavelength. It then directs to bacteria, which has more water content, right? And so because it's got more water content, it's going to go right to it, versus just kind of using a rudimentary kind of drill, which I call it rudimentary, but it's still used. It's still standard of care. We still have to use sometimes.
I know.
Right.
I've been to the dentist. I know.
Right. But having an understanding on a micro level, like what that's doing to the tooth, and having it takes off a bit more tooth structure, leaves in some stuff more than you would want to, versus using a laser energy, which can get to the awesome places and be very conservative in removing tooth structure, and then also leave the tooth like without the decay, without the bacteria, because it's zapped it away.
Yeah.
So
Wow.
that's pretty cool as well.
And even
Yeah.
root canals, and
Yes.
that's a really important technology. It's called the sweeps technology for this particular laser of Pips and another manufacturer laser. But what it does is, because it's sending the laser energy into the canals, and the little minute canals that you may not be able to see or may not be able to even get with the normal instrumentation, that leaves the tooth a whole lot healthier. And I know a lot of people that go, I don't want a root canal, they did this, they did that. Well, we understand that.
Right.
And that's because they haven't been able to use a technology that gets to the places where you can't readily see, so that you can remove the bacteria. Because having your natural tooth is always going to be better than having, I say, an implant placed in place.
Yeah.
Now. So yeah.
It's a cost benefit. That's why we don't jump on to the argument about root canals being terrible, because it's not just one canal. We were saying there are other random canals in the body, and that's why this laser energy is so important, because it uses like this ultrasonic energy to just get to it, and then that makes it a better treatment than what was before.
Yeah. And, in a lot of kids with PANDAS, we talk about things in the mouth, particularly dental procedures, causing a flare. That these kids will get worse after they get fillings placed, or get apparatus put in, or get teeth removed. I could imagine that the way you're doing this with laser assisted dental fillings, that flare, that exacerbation of their anxiety or OCD or whatever their symptoms may be, might be less. Does that seem true?
Less vibration. It's obviously it's more antimicrobial, right? Because you're just removing the actual decay without adding more smear layer. I don't know how to say it. I don't know smear layer of the tooth. So
yeah.
So yeah, less vibration. Even for extractions, after you take a tooth out, you still need to, clean the area out and make sure. And so using that laser energy, you know that it's cleaning the area out, right?
Right, because our mouth is full of germs.
It's
And the oral hygiene is so important to our gut health, to our body health. So I can see where the laser, could really help to decrease the seeding of those germs too into the rest of the body.
Oh, absolutely, absolutely. And we encourage our PANDAS patients to practice better nasal hygiene as well. And this way they can actually maybe have their lips closed more, so that their mouth is not open all the time, which again,
changes the microbiome in the mouth.
Changes the microbiome in the mouth, and may make them be more prone to cavities as well.
Yeah.
The mouth is drier when you're just breathing through your mouth as well.
Right. Can we talk a little bit about the mouth breathing? Because I think this abnormal breathing that a lot of our kids do, moms, dads may not think about that. Yeah, my kid sleeps with their mouth open. What's the big deal? Can you talk about why that is a big deal, what it means, all of that?
Well, the air that's going through the mouth is generally just going straight into your lungs. It's bypassing the natural filter that goes from the nose. It filters, it humidifies it, it warms the air, it prepares the air for the body to use it. It also adds nitric oxide, which is very important in being able to get the blood vessels and get motion and get blood flow easily. So when they're breathing through their mouth, they lose all of that. So it's almost like you're just getting dirty air straight into the lungs. And so your body is struggling. You're having to breathe a lot more, and the body is struggling. The brain's going, this is not air I'm used to. So they have to actually work more using the resources from your brain trying to breathe versus just trying to grow. And so that's what makes it very critical for patients, and especially when they already have the PANS that they're struggling with. And so mouth breathing has also been implicated in a lot of the tonsils and adenoids getting enlarged. And just because you have those taken out doesn't mean that you've taken care of what caused them to get enlarged in the first place. Actually, the research says that about 75% of those do grow back. And sometimes they were taken out because the kid was having maybe sleep apnea symptoms, but 75% of them over the long term still have the symptoms. So only 25% of them got better really over the long term. So yeah, it becomes really important that they're not breathing through their mouth, and you get lip seal. And it's one of those things that when we see them early, we encourage from trying to teach the parents as part of our growth guidance.
Even after we take care of their restricted oral tissues,
Yeah,
they're starting ortho essentially,
yeah,
infancy,
yeah,
meaning we're starting to guide the growth
yeah,
early on, and that
Yeah.
involves lip seal, using
Yeah.
certain appliances, things like that.
yeah, because then the nasal breathing helps with the jaw growth as well.
Right.
So if you're not getting that, then the jaw is not growing like it should, the tongue's not functioning like it should because it's always laying low, and you have a high vaulted palate. When you have a high vaulted palate, that takes up the space on the nose, your jaw remains back, and so your airway is much less.
Yeah.
There's just nothing good for open mouth breathing. And sometimes parents don't recognize it because they think your mouth has to be open like this all the time. No,
Yep.
is the leaning, is the sighing, is the is getting tired. So, and it's ever slightly so open. And for me, for the longest time, I knew I was doing it at night, but I didn't think I was doing it during the day. However, I would always say my lipstick doesn't stay on. And they say, oh, this is non-removing. I'll pay whatever it is I can because it will always be gone. So ultimately, I found that, during this journey when I started learning more, one day we just finished, it's called the Buteco training class. And I was walking into the lounge in our office, we had a big mirror, and I go, oh, my mouth is open. And it's not that it was like open like this that but I could see that it was never really closed. So I was constantly licking my lips because it felt dry. And that's how I knew, oh, that's a problem. That's something.
Wow.
Yeah.
But I mean, you were not a young person, even though you're still very young, but you were not a young person when you found all these things out.
Exactly.
And so even though we're talking about things that people can impact in their babies and at birth and very early on, there are still many things that people can do when they realize this for their older children. Yes?
Absolutely.
Most definitely. And
Absolutely.
a lot of the patterning of mouth breathing starts when the child gets sick, right? And so one thing to understand, that mouth breathing is like rescue breathing. We can breathe through our mouths. That's why it's there as a last resort, last resort, right? And so it's what happens to a child when they're sick. When they're sick, they just like, well, I can't breathe through my nose. And then the pattern continues because it's the easier way to breathe. And so one thing parents can do is that when a child is sick, to really practice nasal hygiene, those is X-Clear or nasal rinses, even if they're not sick. That's the other thing. Think of it like a home filter. It needs to be cleared out, at least once a week. And every other day we say, but not every day, not every often. But if the child is sick, then definitely their nose needs to be clear, encouraging having them with their lips closed. Those toddlers, that when they get sick, then that patterning starts. Then they start having those high inflammatory foods that then cause more, inflammation, more just essentially sticky mucusiness in their bodies. And then if they've got asthma, that gets exacerbated. And so it's like an insidious kind of, habit that has its real effects. That it really has its effects. And the research is now coming out to show more and more, even though it's so simple, right? And when people are like, it's fine, it's okay, it's cute, like snoring, it's not cute.
Nope, nope. And are there other things that you talk to families about their oral hygiene? What else do you tell them? Because I think that has a big impact on all of our children, and especially our kids with PANS and PANDAS.
The more important thing as well, I always go back to when they were babies, or because that forms a foundation, is encourage chewing. By the time the baby is 5 months old, the brain's ready for the chewing reflex. And so chewing is going to help to bring the bottom jaw forward, which gives you more space to breathe. It also lets the tongue be able to move up more, which helps to widen the jaw, and lowering the roof of the mouth, which gives you more space for your nose so you can breathe easier that way. So we'll encourage always getting whole foods, chewing whole foods, and less of the packaged foods, the more inflammatory causing foods as well. And also encouraging the child to sit up and sit up straight and have their feet be supported, because that's part of their posture, and that's part of the brain not having to worry, are you going to fall over? Are you going to, what are you doing? And that's part of what helps it in the parasympathetic state. And have them chew their food at least 15 to 25 times before they swallow it. And in terms of making sure they're brushing well and flossing their teeth, and floss, and they don't have to use a fluoride toothpaste. They can use one that has hydroxyapatite to it. As a matter of fact, I go like, toothpaste is like soap. You can wash your clothes. It's just easier when you have soap when you're washing it. So they don't have to use toothpaste. It's actually the mechanical action of the brush that helps to remove the plaque off of the teeth, because some of these kids are very sensitive, so they can't have sodium lauryl sulfate or some of the SLS that is in toothpaste, and sometimes, but that's very useful to know that, yeah, you can just use an electric toothbrush in water and just get the teeth clean, and also get like a tongue scraper, a metal tongue scraper, and then scrape their tongues every day. That's very helpful. We're not big on mouthwash for the kids, but if they have to use one, just make sure it doesn't have any alcohol in it. There's some that is made of colloidal silver, or what else is there for mouthwash? Some use like coconut wash. I'm not big on the mouthwash thingy, so I'm not the best person for that. I just get the tongue scraping, the brushing, and the flossing, and then eating whole foods. That's very important. And nasal hygiene, because that's help your lips together. And the lips together means that you're maintaining better microbiome, which is really important for the rest of your.
That's really what it is. That's essentially, it's reduced, like keeping the microbiome balanced, reducing the extra acidity that makes the teeth vulnerable. And so what you eat and how often you're removing the plaque, that's what's important. So
yeah, and it's amazing to me how everything always comes around full circle, because we talk about the importance of a whole food diet and importance of a lot of these things with other professionals, and yet here the two of you are saying the exact same thing. So how does collaboration with other healthcare professionals really enhance the outcomes for children with PANS and PANDAS?
I think it's everything, right? If we're getting a proper story about the child and what they've been through, what they're going through, what medications they're taking, it allows us to then tailor whatever treatments that we need to be, whatever treatments we need to do, whatever we need to be able to serve that child. And then we get a better understanding of what they're going through. I think yeah, I think collaboration, so it's just extremely important.
Yeah.
I
Yeah,
can't.
But
and
from my perspective, collaborating with people like you, you know, so that's not being lost in the shuffle, because I'm not going to think about absolutely everything. And yet when I hear that the child is a mouth breather, I'm like, you got to go to
Right,
Lynda and Krystle.
right,
Yeah,
right. And we can
yeah.
quarterback, and it's the timing of things, so it's not so overwhelming for the parent or the child. Like
Yeah.
that, you got to also remember the child versus the teeth, right? And so being able to collaborate with the provider, we can start figuring out when they should go either there or somewhere else or to us, and at what point in time. And yeah, it just makes
Makes for a better
outcomes.
better
Yeah.
outcome for the child, because sometimes you're giving them all the medication that you think they need. Meanwhile, their mouth is open the whole time. They're not eating well. The brain is not even thinking, oh, I got to make this medicine work. And then you're giving more and more and more. Meanwhile, you have to get a basic foundation for them so that their nervous system will be in a more, they can transition from sympathetic to parasympathetic a lot easier. Then that's the goal. It's gonna come. You need a parasympathetic, but you don't want to be in it all the time. And that's what a lot of these kids are in all the time, and that makes healing a lot more difficult.
Yeah, we're not opposed to medications or modern medicine. I think modern medicine is collaboration. You know, I think modern medicine means using less medication and finding ways for the body to be able to receive whatever medication is supposed to at the time that it's supposed to receive it, and then work effectively. So that's how we look at it. So we're trying to create, like I said, that foundation so that a child can be able to receive whatever they're meant to receive from their other providers.
Right,
Yeah.
right. But if I'm talking to like Dr. Scott Antoine about the brain danger response, or I'm talking to one of the other providers about this fight,
Freeze.
flight, or freeze, you
Uh-huh.
know, if we're not thinking about the nose, as you said, and the mouth, we're missing a whole piece of what may be causing those very behaviors, that very, you know, danger
Close to the
from,
brain. Yeah.
yeah,
Yeah.
yeah.
Absolutely.
That's
because-
exactly what
and
we
that good tongue function is what helps the brain be able to have a better lymphatics. Because the brain, that posterior portion of the tongue is really very connected to the SDS, the sphenovagal symphysis, and that's sitting up right on the pituitary gland. As a matter of fact, when you don't have good function, then your whole midface doesn't grow as well. And there's a whole list of hormones that don't get to function properly because you didn't have good midface growth to be able to affect where the brain is able to have that motion so the pituitary gland can function properly.
Wow. And I just want to go back to something else for 1 minute that parents always ask me about, you know, even with laser assisted frenectomies, you know, repairing the tongue ties in that way. Are the exercises, the therapies post the procedure important too?
Oh, yes. Oh, yeah. So
That's
it's
that's one
surgery,
that gets me
surgery.
every time. So
Yeah.
talk
Yeah.
about that.
Surgery, right? You can cut muscle, you can cut everything. But if you don't rehabilitate something that was already dysfunctional to start with, before and after, then you're not going to get the best outcomes. That's just that. And I think it's seen in physical therapy for other types of surgeries. It's seen all over the place. And I don't think the tongue especially should be any different, seeing that it's 16 muscles, 7 to 11 cranial nerves pass through it. Like that's huge.
Wait, say that again. The tongue is
The tongue has 16, like
8
pairs of muscles, and it's got about 7 cranial nerves that pass through it, that it affects, right? Or that affect it. And it's connected to the tip of the toes through body fascia. So something happening in your knee could be affected in your shoulder, could be affected in your diaphragm, affected by your tongue tie. So if you don't get proper education of that tongue that wasn't functioning, that's just looking at you like, yes, I'm tied, but I also need love. before you cut me. You know, if you don't get that, then you're not going to have the best outcome, no matter what tool you use. I think, and there's been studies upon studies, but just no matter what tool you use, you're not going to get great outcomes. I mean, in fact, I'm an example. We learned it. We learned, you know, the release, and I was like, I'm tied. I know I'm tied. Please cut me. She was like, are you sure? Are you positive? I was like, just do it.
And
Not the greatest idea. It's not that the surgery went fine. I'm fine. However, I know that I didn't, and you know, and I did biofunctional therapy after, right? And the more I knew and more I learned, I studied it myself. I started doing it after. Then I saw the results. But I knew at that time period when I got it done, I was like, well, we didn't do it. We didn't. We didn't get much out of this, you know, and it's a surgery. So I learned my lesson. And so I'm a huge proponent of it. It just means take your time with it. Take your time. We use the laser energy, get your body ready for it. Your body has to be ready for surgery in general.
Period.
Yeah, so important. And
so
so much of what we're talking about, you know, it's getting our bodies ready. It's being in the right space. It's taking the right step. And it's also collaboration. Collaboration within our bodies, collaboration of us as healthcare providers.
Exactly. So for that tongue, again, sometimes you have to see, even as an adult, you have to see a PT. They have everything's connected. So they have to exercise other things to remove, maybe to help with the tension that you are having underneath that tongue, to really see the restriction versus cutting blindly. So, and for the infants, because I think the other controversy is that you have to get them now so they can eat and feed. And it's like, no, a child can feed through a straw, a child can feed through a cup, any other way you can feed them. You rather have the child ready for surgery of that magnitude, which is very important when they're infants, than just rush it. You have to get all the players involved before rushing.
Absolutely.
Makes so much sense.
And so the baby's first instinct is to go to the breast. So once you're able to rehabilitate them so that their nervous system has that ability to say, hey, go to the breast, then you're much better off than just quickly going to cut, and it's still more confused and makes it harder for the baby to get back on the breast. As a matter of fact.
Yeah, makes a lot of sense.
And it leaves a gap in the brain. So the brain doesn't like gaps. And that's another thing that we also want to address. It's called the primitive reflexes that are retained. Because a lot of the kids, the PANDAS baby kids, they have a lot of retained primitive reflexes that sometimes then haven't been identified as what could be impeding their healing as well. So don't treat it per se, but we recognize it and we look for people who do treat them and refer them to them.
Got it. And what about some of the more, what we would call innovative tools like ozone or orofacial myofunctional therapy, growth appliances? Talk about those.
So that ozone therapy is there's so much healing from the ozone that I don't even understand it as well as I need to. So that's something an area that we're studying more to know more about. But we've used it on ourselves, and you're going like, how did that just work? And what made it work? And so we haven't understood it as well as we understand lasers yet, but that's something that we know that is useful and has been used for different things like the TMD pain. For medicine, it's been used a lot.
Right.
And so for dentistry now, they're starting to use it more. The guided biofilm therapy and doing the cleanings or having the ozone water is just nice to have it through the office, through the delivery systems. And that helps it because now you know that you're doing much better work because the water is cleaner, and it's more healing as well.
So it's just like souped up, oxygenated water. Very
right.
I mean, we know about the bariatric
oxygen.
Yes, right.
Yeah.
So
the
chamber,
like the hyperbaric.
Hyperbaric. That's what I was thinking. Yes. So we know that oxygen is like its own superpower, and being able to oxygenate water using or oxygenate other things using ozone gas, things like that, it finds the bad bacteria for your body. Like it's
Right.
only what your body needs. And so it'll find the things that doesn't work with your body and it eliminates
Helps
it.
to eliminate.
That's
that.
so far, yeah.
Right.
So that's what we've seen, that's what we've studied, we've used on ourselves. And so we know now for our patients that it's going to be amazing as we add in, even with the laser, that it's just like more adjunctive services to then help clear out the bacteria that doesn't belong, because not all bacteria is bad bacteria, but the ones that are causing the
Problems.
disruption in the body.
Yeah.
Right.
Right. And provide the oxygen to decrease the inflammation.
Inflammation, exactly.
Yeah.
Exactly.
Yeah.
Very important.
So that's been
Very
amazing.
important. Yes. And then some of the other tools we have is called the Alpha appliance. And so the Alpha appliance is a cranial-friendly appliance.
Okay.
Some people want to do what's called rapid palate expansion. Again, it's not necessarily what the body needs, but again, you're trying to get motion. And so the Alpha appliance helps the body, because it sits usually, it's a very tiny appliance. It sits right around here, but it makes the brain feel like the tongue is up. So that, again, you need that tongue motion. So when the body feels like the tongue is up, all these cranial bones are able to just have more motion in them. And so if they have more motion, then it's able to attract the tongue up. And so you actually create the room that you need for yourself. So it's not necessarily about how wide it is, it's how functional it is, which is why, and before I knew all this, I did the rapid paddle expanders anyway, but that's assuming that everybody's symmetrical, and we're not all symmetrical, and we don't all need that width as well. And then what else we use with the Munchie? It's a myofunctional appliance. And what it does is like training the muscles. And you remember when we talked about lip seal? It's very soft and has, maybe you have one in there. It's very soft and it's almost like silicone projections on it that makes it feel really good. It's like proprioception for the body. And so it's actually, even babies love it. So then it helps them, and we tell the parents, just put it in and keep their lips together on it, slowly teaching the brain, making the connection. Your lips are supposed to be together. And it also helps to bring the jaw forward as well. So most of what we're doing is trying to get nature to just show up, because we all have what we need inside of us. It's like looking for what obstacles do we need to move away so that the body can actually heal.
Right. Because our bodies are such wonderful machines.
Yes.
We've just, with all of our toxins and with all of our processed foods and with all of our stress living in this world, we've forgotten to allow our bodies to do the healing, the breathing, that they need to do.
Exactly. And even our aligner therapy, it's similar to the ALF. It's got some projections on the lingual portion, on the tongue portion, so it attracts the tongue to then be super powered, especially in the aligner. And then this will be a myofunctional device for them to chew on or bite, to then fully help even help the jaws grow the way they should grow, even faster. Yeah. So when they're done with we call like an initial phase 1, where we're getting the fight or flight, everything just relaxed, right? Get them into parasympathetic, then you're able to then straighten teeth the way it should versus with force.
Right. That makes so much sense. And I think, it's one of the things that I talk about a lot, that, I see me, for example, in what I do as our family's GPS. But they're still driving the car. And in the same way, this is kind of similar in saying that, we can't force something on families. We can't force something on our children. But in the same way, our children's bodies need to be ready to accept these things that may well be able to help them. So fascinating.
Absolutely.
It's simple, but also very technique sensitive. It's taken us, we've gone to school all over again.
Yeah.
Imagine dental school, medical school, then now another round of that in the past few years. And then it's continuous learning.
That's right.
So we're
It's not a
talking-
bad thing.
No, it's not. It allows us again to meet other professionals like you and be able to like venture out into a different world and really help us understand how the body works, which is
Yeah. And you've helped me understand so many things that just weren't intuitive to me, that I was never taught. And this podcast is for parents and families, but also for professionals. And I hope the professionals that are out there listening will think about the interconnection of all of us and all the parts of our body. Yeah. So how do people find you guys?
Well, our website is www.kidssmile.com, KIDZ smile.com, and we're on Instagram and Facebook and our good old fashioned phone
703-723-8440.
I'm like, who uses the phone anymore? But
Yeah, we're more of that. Yeah, I hear you on that one.
I know, so I'm just saying for like people like me,
Right,
just find the
true.
phone.
True.
That's great. Say the number one more time, just in case people didn't hear it as I was laughing.
Yeah, 703-723-8440.
Thank you.
Thank
And any last words of wisdom, of hope, of anything we didn't talk about that you'd like to leave everybody with?
Yeah, there's a lot that's on our lives nowadays, but there is always hope. We always have to keep hope alive. And it's important for parents to know that, yes, starting at infancy is great. The sooner the better, but it's never too late. I love my CPAP now. I've been off for 3 years. So if it can happen for me, it can happen for anybody else as well. And so always trust that instinct, that motherly instinct that tells you something is not right or there could be more, and look for it and trust it and do the best you can until you know better.
Yeah.
And you do better, according to Maya Angelou, right?
Yeah, exactly. There's such great words.
Yeah.
Well, thank you both so much. Thank you for all that you do. Thanks for sharing your wisdom with people today. And I look forward to seeing you both again soon.
Thank
Sounds
you
good.
so much.
Thank you
Good
so
to
much
see you,
for having
Nancy.
us.
Thank you.
That's it for today's episode of Demystifying PANS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS.